breast cancer rehabilitation. Let's talk about fascia release. Now, there's interchangeable words. We can use myofascial, fascial, or even some therapists use the word soft tissue. And there are a range of different treatments. What I would like to do is talk about the treatments that are okay and the treatments that are not okay. So I'm going to jump to the treatments that are not okay based on one of the cases that I saw in my clinic. And that's where a lady had a mastectomy, and she was about a year and a half down the track and visited her local physiotherapist. And the physio asked if he could have a go at making her chest a little softer. And when she came in to see me, which was 6 weeks after the treatment, the area was still black and blue. So what I'm going to do is show you a photo of what this looks like, just so that you get a good feel for what can happen. If treatments are a bit heavy or a bit heavy-handed, they really are not suited for women after breast cancer. Now, I just let you know that my lady was willing to share this photo to you. So the physio seemed to use a technique that maybe he uses for sports injuries or for elite sports people. And that very firm treatment is not suitable for women after breast cancer. So what can you use after breast cancer? What kind of myofascial, fascial or soft tissue treatment can you use? And that is a very gentle treatment. I will demonstrate my technique, which is based on a Prague technique from Carl Levitt, and it's called barrier release. I've chosen this technique because it is subtle, it is gentle, and it is easy for people to be able to learn the technique and then use it themselves. So I usually get the woman to learn the technique, or if she chooses, the husband can use the technique. So it's hard to even see what the technique is from the demonstration. The basis of the treatment is to work out where the tissue is not moving. So by using the flat of the hand on the skin, then we would imagine that skin and fascia should move every which way. So the technique is to use the hand to find the direction that the skin or the fascia doesn't work, and then take it to the length that that skin and fascia can go. Wait for 10 seconds, and then the fascia or the skin tightness releases, and then what we do is we move up to where that has released. And you can see from the video that's provided that this is a very gentle technique and is able to be used in the weeks after surgery. So once the wound is healed, is able to be used in the weeks after the radiotherapy. So after the skin has healed and has lost its redness, then this fascia treatment can be used again. So fascia releases, there are good treatments and there's not so good treatments. And in fact, I would say there's okay treatments and there's not okay treatments. And in breast cancer rehabilitation, then the treatment is gentle. So if this has been of interest to you, then subscribe. If you have any other comments or topics that you'd like to be covered, then leave a comment. Together, we can make this journey easier.